Hello, everybody. I'm very pleased and honored to present to you today the PARP-1 trial. PARP-1 is the academic-sponsored trial. We're evaluating the maintenance with olaparib in combination with bevacizumab in patients with newly advanced ovarian cancer receiving a standard of care chemotherapy plus bevacizumab. This is our disclosure. First-line bevacizumab increased response rates, prolonged progression-free survival, and also overall survival in some high-risk subgroup. And so it is a current standard of care for most patients with newly advanced ovarian cancer. The olaparib, a PARP inhibitor, reports precedent PFS benefit as a first-line maintenance monotherapy in patients with BRCA mutation. And the activity of PARP inhibitor is observed beyond BRCA and was increased when combined with anti-angiogenic agent. And so in this context, this academic-sponsored trial is the first randomized trial to explore the efficacy and the safety of a maintenance in combination with olaparib and bevacizumab in patients with newly advanced ovarian cancer. So the patient had a stage 3 and 4 were included in the clinical trial with an high-grade serous carcinoma and were in partial or complete response to a standard of care first-line treatment, including bevacizumab. 806 patients were randomized to receive the maintenance of olaparib plus bevacizumab versus bevacizumab, who are an active control arm. Patients were treated for up to 2 years with olaparib and up to 15 months in total with bevacizumab. There are some stratification factors as tumor BRCA mutation and first-line treatment outcome. The primary endpoint was the investigator assessment of the progression-free survival by RECIST, but we have other secondary endpoints as time to first subsequent treatment, PFS2, overall survival, and for sure, safety and quality of life. So the PARP-1 met its primary endpoint for a statistically significant improvement in progression-free survival in the ETT population in favor of the olaparib arm. The median PFS increased from 16.6 months in the control arm up to 22.1 months in the olaparib arm. And so what's that mean? For ovarian advanced cancer who receive chemotherapy plus bevacizumab plus olaparib, in this trial, they benefit of a median time of 30 months, nearly 30 months, without relapse. The subgroup analysis is also really interesting to report. In the BRCA mutated patient, an hazard ratio of 0.31 in favor of the combination of olaparib plus bevacizumab is what we observe in the SOLO-1 trial, where olaparib was evaluated monotherapy compared to a placebo. And as we have more stage 4, more patients with residual disease in the PAOLA-1 trial, it is interesting to note that our PFS in the control arm is longer than in the SOLO-1 trial, which is probably due to the use of bevacizumab. Beyond BRCA, in the HRD population, we also observe an hazard ratio of 0.33, which is very similar to what we observe in the BRCA mutated population. And finally, a new population of patients was identified with an HRD test positive without BRCA mutation, where the hazard ratio of 0.33 report that this group of patients experienced a substantial benefit with the combination, with a median PFS improvement of almost 1 year. And so our conclusion for this clinical trial is to say that PAOLA-1 population is representative of the majority of patients with an ovarian cancer is first line, as the patient selection was not restricted to surgical outcome or BRCA mutation. This trial met its primary objective, demonstrating a significant improvement in progression-free survival for the combination of olaparib plus bevacizumab compared to an active control arm. And the pre-specified subgroup analysis report that patients with tumor BRCA mutation and patients with an HRD test positive have a greatest benefit. And the result reveal a new population beyond BRCA, HRD positive, who experience a substantial benefit with the combination of olaparib and bevacizumab. I did not detail the safety, but I can say you that the safety profile of olaparib in this trial is similar that we observed in previous clinical trial where olaparib was evaluated in monotherapy, and adding olaparib did not impact on the bevacizumab toxicity and quality of life. Thank you very much.